Hello, everyone. Good evening, and welcome to the Project Offbeat podcast, the podcast where we feature the offbeaten careers, or what we call the non-corporate careers, to our corporate professionals. No, so Matt, tonight, we have a very special and knowledgeable guest today. No, he's the father of my good friend Ralph. Ralph, shout out sa'yo, no. And also no, my sister has talked so much about this guy. He became her teacher in her class, no, for my mga ka-offbeat. Yung sister ko pala is a doctor, no, so medyo may hint na kayo kung anong career tayo today. In today's episode, we're featuring the off-beaten career of a doctor. 'Di ba? I know, baka pwede niyong sabihin na doctor? Off-beaten career ba yun? Di ba? Almost all of our parents want us to be doctors before. Right? I don't know for whatever reason. Siguro economical. Siguro it makes you smarter. Right? I don't know for whatever reason. Right? But today, we're locking down or we're narrowing down to the career of an ophthalmologist. Di ba? So ano tong big word na to, team, no? Anong big word na to? It's basically the medicine, no, the medicine field for eye care and surgery for the eyes, no. So it's gonna be a lot to unpack today, right? So get ready for a great episode.
Siyempre naman, our guest is a veteran doctor or ophthalmologist with over 20 plus years of experience. Imagine that. He now works in Cardinal Santos Medical Center as a consultant and is a tenured professor in ophthalmology in his alma mater, UST Med. Lastly, he has also multiple publications under his name, having published a great article on using computer assisted image systems in orbital surgeries.
Makikita naman natin, no, ka-offbeat, no, this is gonna be an intense scientific episode, and I hope you guys are very ready. Our guest today, without further ado, is Doc Alex Sua. He joins the Project Offbeat podcast today to talk about the career of being a doctor and an ophthalmologist. Good evening, Doc Alex. Welcome to the show.
Good evening, Matt. Good evening, Lance. Thank you for that kind introduction and for inviting me to this program of yours. So it's nice to have you.
If baka hindi ka makapaniwala, no, but you are the first doctor career that we will be interviewing in this show. So medyo hesitant kami
Oh, thank
before.
you for
How do
that.
we talk to a doctor, right? Someone that's so knowledgeable, especially like yourself, no? So thank you for really joining us in this show, diba? Doc, ang billing sa akin ni Ralph is we really need to research about what's the difference between an ophthalmologist versus an optometrist and an optician, no? Ang daming careers that sounds like the same, Doc. Doc, can you explain to us anong difference ng mga careers na to?
Well, basically, an ophthalmologist is an eye doctor. The eye doctor that takes care of a lot of eye diseases that may affect the patient. No, so be it with regards to your blurry vision that needs eyeglasses, or are you having a sore eyes that needs medication, or you have a cataract. Those are the things that are being treated by your ophthalmologist. It's hard to spell, it's quite hard, and sometimes that's one of the questions that we throw to the students. Spell ophthalmology by itself, it's really hard to spell and pronounce. Next is optometries. Optometries are the professionals who measures the grade or power of the eye that would require eyeglasses. So they are the ones responsible for prescribing your eyeglasses and prescribing for your contact lenses that you wear. Optician, however, is another field of eye care wherein which these are technicians who physically make those glasses for you.
Yeah. Yeah.
Those those
Iba-iba pala.
professionals who
Mhm.
mold the eye contact lenses for you.
Mhm. I see, I see. Thank you, Doc, for that clarification, no? Siguro ang question ko, Doc, iba-iba ba 'to ng educational requirement? Like, I would assume, Doc,
Yes,
if you're
of course.
making a surgery to someone's eyes, you have to study way more years, no, Doc? Totoo ba 'yon? Na
That's
pinakamatagal yung
true.
Siyempre.
ophthalmologist, no?
Yeah, among the three, the ophthalmologist would require a pre-medical course. That would
Mm.
mean either you go into any paramedical field like
Yeah.
medical technology, be it physical therapy, or something
Yeah.
that is related to the medical field. That would require a 4-year course. And
Mm.
after which you take the proper course, the proper medical course. That is a 4-year course again, adding up to the years of your education.
Yeah.
So that after which you enter into what we call as internship. So you go into seeing
Mm.
actual patients under your
Yeah.
care, but still under the supervision of higher professionals in the medical care to get your
Mm.
license. That's not it yet. You're
Ay, di pa.
considered
Okay.
a general physician.
Yeah.
You are considered a general physician. So that entails 10 years of studying. You are not yet an ophthalmologist. Then you choose what field you want to go into. If you're interested in eye care, then you go into ophthalmology. If you're
Mm.
interested in medicine, then you go to internal medicine. Like
Mm.
for me in ophthalmology, it requires you 3 years of training, 3 years of residency training before you come out to be a general ophthalmologist.
Ooh. Mm.
And if you need further study, if you need to diverge into the different fields of ophthalmology, there are a lot, at least 10 subspecialty if you want to go into
Grabe.
further study in ophthalmology. So, for myself, masyado akong mahilig mag-aral. So, we go into two fellowship. I go into ophthalmic pathology that requires a year of training.
Yeah.
And after which, uh, I'm not yet satisfied with just examining the eye specimen. Why not me myself doing the surgery? So I go into another subspecialty, which is ophthalmic, plastic, and reconstructive surgery.
Oh,
That
wow.
also requires 2 years of training.
Oh, wow.
So medyo matagal, no? While optometrists, on the other hand, would require a 4-year course, no? And after which they come out to be professional
Yeah.
like us optometrists, no?
Mm.
But sometimes they're also being called doctor, no? So when you go to some clinics or uh, or shall we say, the ones who are selling eyeglasses, sometimes they are being called doctor. Ay, doc, anong power nito? So sometimes uh, they they may be called as doctor. But the proper designation is they are OD. There's a designation after their name is OD, while for us it's MD, medical doctor. So that's the
I see.
difference.
I see. Thank you, Doc.
Grabe, Lance, makita mo pa lang, kahit sa ophthalmology pa lang, there's so many ways or so many routes of
Yeah.
beaten paths that you can choose, no? Quick question, quick follow-up, no, Doc. What is Dr. Jose Rizal? Is he a ophthalmologist?
Yes, Dr. Jose Rizal
Ayun.
is an ophthalmologist and
Mm.
he had his training in Germany. He is
Grabe,
the
no?
first ophthalmologist, Filipino
Mm.
ophthalmologist, and he is the one who operated on his mother. You know,
Okay.
Wow.
Well, Doc, I guess going to the career part of it, no? Were you ever brought up to be a doctor? Like, let's set aside the ophthalmologist part of it first, but did you ever set for yourself na I want to be a doctor, or did your parents ever set it for you? Was it ever something that you were uh constantly pursuing even as a kid?
well, Matt, to tell you frankly, I'm a very sickly person. So I
Mm.
always catch sore throat. I always got fever. So all those sorts of things. And where do I go to? To the doctor. No? And it so happened that we have a family doctor who is a cardiologist. No? A cardiologist, a good friend of my dad, a good friend of my dad. So we always always frequent his clinic. And there you can
Yeah.
see the rapport of being a doctor, a true doctor, how caring he is. Not only
Yeah.
on me because ah ano ako kakilala niya, no? Best friend, anak ng best friend. But no,
Yeah.
also other, no? I can observe other patients. He treats them the same way. So compassionate, no?
Yeah.
So dedicated in treating this patient, no?
Yeah.
And from there, it comes to my mind that I want to be like him someday. No? I want to
Yeah.
emulate, no, his compassion in treating patients, his
Yeah.
dedication, no, to his work. No? So that really has embedded in me early on. I want to be like him. So
Ganda.
that's how
Yeah.
uh, being a doctor comes into my mind.
Yeah. Doc Alex, actually, it reminds me of my sister, no, who's actually almost going 30, I think, but yet she's still studying, she's in residency, diba?
Don't mention
And
her age. It will tell you
secret
how
lang.
old I am.
Secret
Wag
lang, no?
naman.
Secret lang
Well,
natin, no? But Doc, parang ang parang question ko dito, parang the way you mentioned how important it is for doctors to be there for the sickly, 'di ba? Is it worth it, Doc, no? Kasi ang daming years mo nag-aral, is it the ultimate test of delayed gratification? Doc, ang tagal niyo nag-aaral and you don't know if you will be a successful doctor in the future, right? Yet you still persist, 'di ba? Gano'n din ba talaga ang pagiging doctor, You really have to put a mindset where this is for the benefit of, the world, 'di ba? Matagal akong mag-aaral pero worth it 'to.
well, it's all worth it, no? And I do not count the days, no? Gaano katagal. See, everything just comes, no? You cannot tell which one is coming towards you. I'm not sure I'm going to be an ophthalmologist. I'm not sure I'm going to be a pathologist. And I'm not sure I'm going to be a plastic surgeon.
Yeah.
But all this just came to you and wala, nandyan na. Okay? So I think all of these happens for a purpose, no?
Yeah.
And I don't really count the days, no? For me, a lot of things happens to me. As you know, Lance, no? Maraming nangyari sa akin, no? And it also has delayed my career, no? And parang pinipigilan ako, no? But wala lang, just go on. As someone has just mentioned to me, just go with the waves. Go with the waves. Something will push you forward and forward. Just go along with it. No? So you don't count the days. You don't. I'm not aiming for those. But the satisfaction I get is from the smile of my patient. That's something that money cannot buy. And
Ganda.
really, if you're a businessman, you earn something, it's never satisfactory. But the smile of your patient, of you being able to treat him, that's something
Yes.
else. No, I make someone being able to see. That's really something. No money can buy your eyesight.
Tama,
Agree.
yeah.
Agree. Agree yan, Doc. Kahit anong technology dyan, isa pa rin ang mata, isa pa rin ang nakikita ng mga eyes natin, no? Doc, you talked about satisfaction earlier, diba? Can you take us through what's been the best, best career highlight that you've had, no? Any specific, patient that came into mind or any specific lectures that came into mind, though? What's been the best highlight of your career so far?
Well, to tell you frankly, Lance, I'm a cancer survivor. No, so
Wow.
I think there is a purpose for me coming back. No, and there's something that I need to fulfill, and there's something uh, granted me that opportunity to be able to do more and to be able to help others more, probably for my family first and my patients, no? And there's a purpose for allowing me to continue with this practice. And I thank the Lord for each and every moment of that. No? So that's something that I want to share, no, for the remainder of my life to do something good for other people.
We really appreciate that story, no, Doc. I think it definitely puts life into perspective. Na it's not really about the money, but it's really about helping people and helping others. And that's also what I admire most about people who choose to be doctors, to go into the medical field, because it's such a big sacrifice, I would say. I mean, maybe for
Sobra.
people in the medical field, it's not that big a sacrifice. Pero for us na corporate, parang shit, parang hindi namin ma-imagine na we go into this field. So, saludo kami sa inyo. My question lang for you, Doc, no, is as you were going through the path of becoming a doctor, you could also always become a doctor in cardiology, like the doctor that you were inspired by, right? um what then
Correct.
made you choose to go into ophthalmology? I mean, I'm sure that there's a lot of people in the medical field or even in pre-med that are listening to this right now, and they might be asking, saan ba ako pupunta, like specialization wise or whatnot. Parang how did you yourself kind of choose your way through your specializations, through your field, no? I myself don't know if how you would go about it, because it feels like a very specialized course nga talaga. How would you advise our listeners to go about it?
Thank you very much, Matt, for that question. And I can answer that only for myself. Okay. See, after I finish medicine, I'm in the same situation like anyone else. All subspecialties I want to go into. I want to go into internal medicine. I want to be also a cardiologist to able to help those who have heart failure or heart attack. I want to go into surgery. I want to operate because I also have kidney disease, no? And I have
Mm,
underwent surgical procedure, several surgical procedures, in fact, no? But nevertheless, I thought of one subspecialty or one specialty that can combine all these subspecialties into one.
Mm.
And I don't get into the trouble of having a lot of emergency calls every night. So I can sleep well at night. See, in ophthalmology, you are in such a situation. No much emergency call. No, unlike my wife, she's a pediatrician. She gets the call all the time. So be wary who will be your partner. Sorry. Okay. Tahimik na nga ophthalmologist. But as I've mentioned, it's all subspecialty into one. So as an ophthalmologist, you get to see inside. No? Through the eyes, you're able to appreciate patients with diabetes, patients with hypertension, without them even knowing that they have diabetes or hypertension. Just by the look inside the eye, you will be able to tell a lot of things. No?
Uy, may
You'll be
ganun
able
pala,
to
yeah.
tell the patient has lupus, no,
Mm-mm.
arthritis. A lot of them are manifested in the eye, in that very small organ. See how important that structure is. You can do refraction. You can earn some money by prescribing eyeglasses.
Mm-mm.
You have both medical field and you have the surgical part. Unlike cardiologists, you just use your stethoscope and go into the clinic without any surgical intervention. You cannot do anything to correct the heart failure just by giving drugs. But as an ophthalmologist, you can treat patients by giving medicine and you also can do the surgical part. But that is physically removing the cataract from the eye and allow the patient to see. Because with just eye drop, that cataract cannot go away. It needs surgical intervention. So both
Yeah.
you can have a clinical setting, you can see patients outpatient, and likewise you can do surgery. So you satisfy both fields. So there's a lot,
Agree.
no, that you can go into. Like for example, we also take care of pediatric patients. So those children also have eye problems. So I go also into pediatrics. Okay, I
Tama,
can see
yeah.
patients who are pregnant because in pregnant patients sometimes they do develop what we call as eclampsia, hypertension, and we are the ones who diagnose them. So we are also into
Yeah.
OB/GYN. We are also into
Grabe.
neurology. See, there are 12 cranial nerves. There are 12 cranial nerves, and six of them involves the eye. So we got to learn also neurology. Okay? So being a neurologist also requires some knowledge about
Yeah.
ophthalmology because most of the cranial nerves that you have belongs to the eye. So a lot of fields goes into one. So that's the beauty of ophthalmology.
Galing 'no, Lance. Parang it's just like one field of medicine. I assume it's also the same for others, no? But you can kind of touch upon so many aspects of other fields as well. Parang it's so interesting because I used to think that it's just, nasa ophthalmology ka lang, 'di ba?
Yeah.
Uh
Yeah.
Parang you won't go elsewhere, no? Um and about the lupus part, actually, Lance, si Michael Jordan, I think he has yellow eyes, 'di ba? Parang may pagka-lupus
Talaga?
daw yung problem. Oo, oo,
Wow.
I saw
Yeah.
this online also.
If you're into some advances, we are the I would consider we are one of the most advanced subspecialties. No, because we
Yeah.
Mm,
go into lasers. We got a lot of precision surgery because what we are doing is microsurgery. We have to use microscope for us to be able to do our surgery. So a surgeon we can do surgery, we can do appendectomy, but the general surgeons cannot do a cataract surgery. So that's how
Mm.
precise this kind of technology is. No, so that's the difference.
Doc, na-mention mo kanina, auntie, no? Si Auntie Christine, pediatrician, no? Do you guys work together? Does she refer patients to you whenever they have eye problems?
Yeah, yeah. So
Siyempre.
so in recent times, no, she's able to refer those patients to me. No,
Yun.
before she watches me how I treat patients, no, and
Oh,
she's the one giving the medicine herself.
learning from the best.
But now
tinetest ka
she
muna, Doc, tinetest ka
uh,
muna.
tinetest muna. So it's kind of like a sharing, no, sharing. But long and behold, no, nagugulat na ako sa kakasilip niya sa akin. He now learns how to detect
Ah,
some cases that would require the expertise of an ophthalmologist. No?
yeah.
So I was also surprised that she was able to diagnose a patient with the optic nerve problem. No? So
Ganda.
the optic nerve
Grabe.
problem, kailangan specialty yan ng doktor. But yun,
Mm.
sa
Yeah.
kaka-observe niya, she's now also becoming a pediatric ophthalmologist.
Grabe.
Wow, may
That
specialty na
So,
rin.
so that's the teamwork
Oo.
between the two of us.
okay. Doc, meron akong question in terms of, do you think that the underprivileged kids, no, na probably won't have enough money to go into a career that requires them to study for 10 plus or 20 plus years, no? Do you think that taking medicine is only for the privileged few, right? Or meron ng opportunities right now, no, that are paving the way for even the underprivileged people to take up the art of medicine?
Lance, thank you for that question. And me as also a faculty member of UST, and I've been a part of the, shall we say, scholarship uh, program
Oh, wow.
by the university, and there are a lot of organizations, no, that accept the call or the challenge of helping these people to be able to gain entry into the medical field. No, so they are being provided for free. No, they are being sponsored. Mind you, no, I don't know if I can pluck it out. Would you imagine how much is the enrollment fee to study medicine? Example for Ralph,
Yeah.
I just paid his tuition fee for his second
Yeah.
semester, and it amounts to 145,000
Oh
for
my
one
God.
Wow.
semester.
Oh my God.
So
Wow.
for two
Wow.
semester, it could roughly run about 300,000 for a year times four, no? 300 million,
Yeah.
no? But during my time, it's just around 3,000 pesos. See how
Yeah.
far it goes
Wow.
already. So that's how expensive, no, studying is. But mind you, even for college students, one semester will already cost around 75 to 80,000. For
Yeah.
example, in Ateneo, you can also vouch for that. No, it's not cheap. No? So
Yeah.
for someone to be able to finish medicine, it means a lot. No, and there are a lot of NGOs who are willing
Great.
to
Yeah.
share and help.
Buti na
No,
lang.
we have
Yeah.
this organization also where I am part of. It's Chuchi. No, it's a Buddhist uh, charitable foundation who are
Yeah.
willing to share a hand, no, in helping this and molding these patients, these students to be future doctors. No, we cannot deny them of their future. No, no.
Mm.
So, Doc, I think you mentioned it already, no? But you mentioned something about teaching people or teaching students in UST. I just wanted to ask, how does that feel compared to, treating patients, diba? You said something about how a patient's smile could make up for everything, no? How does it feel naman if to mentor these students who are wanting to be a doctor such as yourself?
Well, thank you again for that question. No? So being a doctor can involve a lot of things. You have the time to treat your patients, but you also have the chance to teach your craft. I myself is lucky enough to be able to be accepted. No? That is way back 1998, I think, when I came back from my fellowship training at John Hopkins, and uh, I was accepted, no, to be part of the teaching faculty. At that time, before you could be able to allow, they will allow you to enter the hospital and be part of their medical staff. You should be able to teach in the Faculty
Hmm.
of Medicine and
Talaga?
Surgery. That is a
Okay.
requirement. So that's a very hard process. So not unlike now, no, you want to just practice your own craft as a medical doctor, you just go to the hospital. But during our
Mm.
time, for you to be able to practice your craft, you should be able to teach. Luckily, I was accepted to be part of the Faculty of Medicine and Surgery. And even during my residency, during my training, I always like to teach the residents. I like to teach
Yeah.
the students. No, in fact, that's the way I got my wife. Okay,
Talaga? Talaga?
I
Right.
was a first year resident then, and she
Mm.
was my clerk. She is at
Yun.
that time fourth year medical student. No, so ganun ang biruan nun eh. So you look for someone lower than you and try to look around. No, so that's
Right.
how you spot for your potential or potential girlfriend. And I love to teach, and I make it a point that someone that I teaches really learns from what I'm teaching, you know.
Yeah.
And I make sure that they learn something out of what I'm teaching them, no. So I'm not just oh, sige, ganyan ganyan, just memorize this and that's
Mm.
all.
Mm.
I make sure that they understand the topic. Sometimes they might say the makulit ako, I'm very strict, no, in teaching. Probably Lance, your sister, may be a witness to that, no? But I make it a point that they learn. I make it a point
Yeah.
that they learn, no? And something to carry when they finish medicine. because at
Beautiful.
times they might not be ophthalmologists anymore. They will just
Mm-mm.
be pediatrician or internal medicine, cardiologist, but somehow they have that imprint, no, of some knowledge about the eye, how they treat the eye. No, it's not,
Yeah.
not something that you memorize then wala na. Okay, I make
Yeah.
it a point na sana maintindihan nila. Recently, no, just last December, when I'm trying to buy my medicine at Mercury, someone approaches me. Hindi ko siya kilala. Hi, Doc. Kumusta ka na? Remember me? No,
Grabe.
not at all. Tapos sabi niya, she was my student. No? She was my student long, long time ago, way back 2002. No? And
Yeah.
she's now a very prominent hema-oncologist at PCNC. So sabi ko,
Hema-oncologist. Okay.
wow, ang
Grabe.
tanda ko na. I'm so old already.
Doc, you became so memorable to her, I guess, 'di ba? Kasi hanggang ngayon natatandaan ka pa 20 years after, right? Imagine that.
Baka may trauma.
Doc, I mean, mas okay na maging strict or for your students to make mistakes in front of you. Because I also remember recently my friend posted, she's in the medical field also. Mas okay na magkamali during this stage versus, when they're already
Exactly.
doctors. So parang,
That's
It's
oh,
true.
yeah.
That's
like
true.
I think it's correct what you're doing, no, Doc.
Yeah.
Hopefully, you
Yeah.
just don't traumatize them enough or too much.
Yeah.
Yes. Yes. But most of my students are afraid of me because I'm not shouting at them because I try to probe them with questions. So I'm not
Yeah.
satisfied with
Tama, tama.
just one correct answer. I try to
Mm-mm.
dig in more to see how well they know the topic. So by
Yeah.
that, sometimes others doesn't want to be probed. So
Mm-mm.
they're not keen with my way of teaching. But
Yeah.
that's my way of teaching. I want to know if you know what I'm saying, if you really know the topic, any of that answer, no? So probe first before you teach, so you know what
Yeah.
is lacking in that topic that you should be able to teach
Mm.
them. No? Hindi yung,
Super
ito,
interesting. Yeah.
ganito, tapos na. That's it. No, I want you to learn, no? And by that way, you be able to learn and be able to absorb. With that experience,
Yeah.
uy, nakakatakot, tanong ako ng tanong. Pero that's the way you retain those
Yeah.
information.
Doc, imagine mo naman ngayon, Doc, that you're teaching a class not of medical students but of corporate professionals, no? Like me and Matt, no? And then na-invite ka as a guest lecturer, Doc. Anong topic mo, Doc, kapag mga kausap mo mga corporate professional? Would you teach them, their whole work, Doc, is looking at the laptop the whole day. And I bet that's bad for the eyes, 'di ba, Doc?
Correct.
So, ano ang magiging tips mo para sa mga corporate professionals, no? In terms of managing their eye care.
At the academy, they're now trying to adopt what we call as 2020. 2020 meaning you spend around 20 minutes in front of the computer. So you do your ordinary near work. No? The problem is in front of the laptop, you are doing what we call as near work. And because of
Near
that,
work.
you are
Mm,
actually contracting your eye muscle for you to be able to focus at near.
yeah.
Okay? So if you keep on contracting your eye muscle, there will come a time that it will get tired. But the eye usually doesn't complain. It doesn't uh, tells you that it is painful. But it seems
Yeah.
to be that sometimes your eye becomes so red, sometimes you become so feel so tired because of that, and sometimes even to point of headache, and sometimes
Yeah.
vomiting. No? That is because of the constant contraction because you're trying to focus at near. When you look at a distance, that's the time that you relaxes your eye. So the point is if you spend around 20 minutes in front of your laptop, our advice is after 20 minutes, you try to look further away. So you try to
Mm,
look far at a distance for around just 20 seconds. Sasabihin mo, ay
20 seconds.
nakakapagod yun. But just only 20 seconds is enough. No? for you
Yeah.
to be able to somehow relax your eyes, no?
Yeah.
And would you test for yourself, no? Like say, if you're so into your work, in your work, have you ever thought of blinking your eyes? No, di ba? Hindi. And our eyes needs frequent blinking to it wet out, no? Just like the
Yeah.
car windshield, it needs a wiper, no, to make it clearer. Sometimes we don't
Yeah.
do that, and because of that, our eyes gets very, very dry. And if
Mm.
it is dry, then comes eye wetness, discomfort in the eye, and eye strain.
Mm.
No? So 2020, only 20 minutes reading, then spend 20 seconds looking at distant object, far
Yeah.
away, 20 feet.
Yeah.
So,
Yeah.
so
Alam nyo na mga ka-offbeat. Tingin-tingin tayo sa distance every 20 minutes, no? Para mapahinga natin yung ating mga mata.
So, Doc, I guess, we talked about your career, how you kind of chose this path through ophthalmology. You talked about teaching as well. I'm kind of curious now. What would you say to people who want to be doctors, basically, those taking up medical studies and whatnot? Those that are pressured maybe to kind of earn immediately after they become doctors, or if they enter the workforce, the medical workforce, no? Parang is I want to look at the business side of it. Are there any business strategies that you would advise people? Like, for example, should they go into clinics versus hospitals? Should they associate themselves with maybe fraternities or sororities or something like that, so that they can have a network or something? Do you have any tips in terms of ensuring their business, ensuring they can earn in the future, just to make up for how much they spent for
time
this
they spend.
pursuing their medical dream, diba?
Something that I would advise the future doctors or those who decide to go into medicine, first and foremost, if you want to go to medicine, you cannot be rich.
Aray
You
ko.
cannot be
Grabe
rich.
naman yun, Doc. Grabe naman yun.
Yes.
Really?
If,
Really?
if you're going to be a doctor, a real doctor, in your mind, in your heart, you can never be rich because you deal a lot with very poor people where they cannot even afford to pay your bills. No? Ang bibigay mo kasi, maswerte ka na nga kung ibibigyan ka ng isang ipirasong itlog. Even a piece of egg they cannot afford. So
Grabe.
how can you get rich being a doctor? So if that's in
Yeah.
your mind, please don't dream to be a doctor. It is not your profession. But but you need to earn something for you to be able to survive, no? For you to be able to keep on paying the rent of your clinic, no?
Mm,
For you to be
tama,
able to
tama.
build a hospital, no? But
Mm-mm.
that should also come into consideration. How do we earn? No? How do you pay the rent? Like for me, no, I'm charging patients. Of course, there is a professional fee. So there are patients who cannot afford. There are patients who can afford, and those patients who are more than able to pay your professional bill. So you have to gauge your patient. If you see that the patient cannot pay, then probably you may not charge that high, no? Or not
Mm.
even charge at all, no? Pro
Mm.
bono. But for those who are able to pay, these are the patients that you can charge and somehow being able to compensate for the loss that you give for charity. Okay? But for me, I do not count that anymore. Just what the blessings can give you, no? For
Ganda.
a charity patient, bigyan mo ng ano, wala akong magigain, no? I don't gain anything. But the mere fact that you're able to treat that patient, no? First of all, you gain experience from that case itself, be it a surgical case or a medical case. That knowledge you can apply for the rest of your patients, no? And there's also that emotional satisfaction that I mentioned earlier. No money can buy. Mas mahal pa yan
No
sa
money
pera.
can buy.
No money can buy. Because let's say you're able to help that person, and that person owes you something in return, really, no? And there will be a spread of mouth. They can tell everybody, oh, I got healed by this doctor so and so. Then that spread of mouth can also bring in other patients to come and see you. So wag mong iisipin na, ay, nalugi ako kasi libre ka lang. No.
Mm-mm.
Charge it to experience and all things will come back to you. No? It's
Ganda.
nothing about
Mm.
money. Kaya hindi ako mayaman.
Talaga
I
ba,
don't
Doc?
know how to earn money. I'm not able to earn money. But somehow I have much, much experience, no? In terms of cases, yun. So
Yeah.
you try to earn money in a different sense, no? You try
Mm-mm.
to
Yeah.
earn
Tama.
money up there. You try to earn money up
Oh,
there. Because if you
ganda,
gain
Doc.
more money, no, that's the time you become more greedy. You're not satisfied. Eh. You're not satisfied with the money and you
Oo.
want more and more and more. So, in life, not only as a doctor or any other profession, there should be satisfaction. You know how
Yeah.
to be able to be satisfied. If you are satisfied, then everything will be okay, no? Hindi ka na mangongooblema, no? You don't have headaches anymore trying to, oh, paano ako kikita? Paano pa ako kikita? Then it becomes more stressful to you. Oh, mas
Mm,
mayaman yung
mm.
isa sa
Sa
akin.
mindset.
Sa mindset mo, that person is so rich, no? I want to be like him.
Mm.
So you work hard and hard and hard and hard because you're envy. No? So you're stressing out yourself, di ba?
Yeah.
So, ano mangyayari? Sasakit yung puso mo, makaka-high blood ka, you cannot sleep at night because you keep on worrying, oh, the next day, may pasyente ba ako o wala? So, let go of that. Be satisfied of what you're doing and be happy.
Yeah.
And happiness is also something that money cannot buy.
Doc, tawag diyan ano, good karma.
Oo nga eh. Tsaka
Yeah.
Matt, I think that's a misconception, no? Because everyone thought that, parents want you to become doctors because, you can live life and you can charge high PFs and
Comfortably. Yeah.
you can be late at your clinic pero pipilahan ka pa rin ng mga pasyente mo, 'di ba? So it's
Mm.
really refreshing, Doc, that you mentioned that na posible pala na ang doctor, mali mo hindi talaga kayamanan ang habol, 'di ba? Which is very, very, very refreshing, no? Doc, siguro sa akin naman, no, there has been a proliferation right now, Doc, sa social media na maraming, let's just say, a doctor influencer, no? No, lalo nung COVID times, Doc,
Ay.
everyone is saying their part. Everyone is saying that this is what you do to avoid COVID. This is what you do if you get COVID. 'Di ba? Tingin niyo, Doc, bakit naniniwala ang mga Pilipino sa mga ganitong influencers versus professionals like yourselves? 'Di ba? Is there something that we can do for doctors, para mas sila yung pakinggan, sila yung trusted source ng mga pasyente?
So, that's very true, no? So, sadly kasi, uh, the mindset of the people is they don't value their health. They do not value their health, no? Like, for example, you are willing to buy a very expensive cell phone, no? Which costs around 40 to 50,000 pesos. Pag sinabi mo, oh, cellphone, bili tayo. Ay, kailangan ko, bilhin ko yan, maganda. But if you're suffering from something like blurring of vision, malabo na yung mata mo, no? And
Yeah.
the doctor, for example, say, oh, you have to undergo surgery. Ay, doc, magkano po yung operasyon? And the doctor say, oh, it's around 50,000 pesos, no? You think a lot, no? You think every night, no? Hindi ka makatulog. Pero pag sinabi mong bibili ka ng cellphone, there and then, sige, bili natin kasi kailangan natin.
Yeah.
You take your health for granted. Similarly, doctors are taken for granted. no? Just like what
Oof.
happened during the pandemic, no? Wala naniniwala sa doktor eh, 'di ba? They believe in politicians, no? They believe in let's say, oh, may ivermectin, no? So that's the way to do it, you know.
Yeah.
But let us accept this, no? COVID, we do not know really, no, the right treatment for COVID. So there's a lot of hearsay. There's a lot of vaccines coming out, no? Siguro, after 6 months, may bagong vaccine na naman tayo. So
Yeah.
that's the real treatment. Up to now, hindi pa natin alam what is that COVID virus. Is it human-made, no? Or
Yeah.
is it a natural infection? Hindi pa rin
Mm-mm.
natin alam. So politically, influencer din sila. So we are in an era of false information. Let's accept that. Wala naman dati na mga fake news eh. Diba? Ngayon lang during the pandemic na there is mushroom of fake news in the
Yeah.
social media. So biglang boom, no? So because we are kept inside our house, we're not able to see the real world outside. So we are being feeded of
Yes.
chismis dito.
Yes.
So those
Mm.
are the influencers. They are louder than the real doctors.
Mm.
Talo kami. And we try to influence others in the social media pero mas mahina ang boses ng doktor.
Mm-mm.
No? Because for one, we spend more time treating our patient than to be indulged in this campaigning of false information, mamamatay. We spend
Yes.
time
That's true.
in the social
That's true.
media, so hindi. So we spend time treating the patient, no? Mhm. Kaya maraming nagagalit sa government, no? The nurses and other healthcare professionals because of that. Pero doctors don't have time to argue, don't have time to go to the streets and do the rally, no? We have to spend time with treating our patient. Kaya ang
Yeah.
sabi nila, ang mga doktor napakadaling lokohin. Kasi straight tayo mag-isip eh. Ang concentration na lang, always in our mind are the patient.
Thank you, Doc, for sharing that. Alam mo, as people in media, me and Matt, no, I feel like this added responsibility for us to actually
Correct.
share the careers of professionals like yourself, lalo mga doctor na can only spare you a few hours to talk, but it's worth it. Kasi kayo talaga yung nag-aral, kayo talaga yung nag-research about these diseases, no? So, thank you,
But
Doc.
Lance
Thank you,
and
Doc.
Matt,
Yeah.
we are not perfect. We are not perfect. There are a lot
Yeah.
of things to learn, no?
Yeah.
Even outside our field, no? Even
Yeah.
outside our field, no? That we want also to learn the business side of medicine and so on
Yes.
and so forth because we need to survive also.
Yep.
Because
Agree.
nowadays
Agree.
even doctors becomes very competitive.
Doc, actually, that's all there is to the interview. Maraming salamat, Doc,
Well,
for joining us today. Sobrang ganda ng episode natin. Ang dami namin natutunan about our eyes. I'll never forget about 2020. Gagawin ko na yan simula bukas pa lang, no? Uh, anyways, Doc, uh, this is your chance, no? Tell us, where you are, what are you excited about? May gusto ka bang i-promote, regarding your field or industry?
well, just want to plug or something that you should be able to love your eyes and take good care of your
Yeah,
eyes, no?
yeah,
You only get one life to live, no? And you
yeah,
only get one eye to see, no? It's a beautiful world, no? So it's a God-given gift, no? Your
yep,
eyesight. So
yep.
please take good care of them. Huwag niyo siyang
Right.
pabayaan. Kahit sabihin mo, ay, ang liit-liit lang ng mata eh. Pero try it for yourself. Kung mawala ka ng vision, it seems na nawala na yung buong mundo. So please
Yeah.
take good care of your eyes. No?
Thank you, Doc.
All right.
Doc, if our listeners want to also have a chat with you or maybe listen to some of your lectures kagaya ng ginawa mo today, Doc, no? How will they do that? Meron ka bang mga YouTube videos, Doc, or anywhere, no, where they can also learn from you even if they're not medical students?
Sorry, Matt, no? But thank you for that idea. No, I'll try to make
Yes.
some for the
Thank you, Doc.
audience, no, for the YouTube. But if they have any question, they can just simply email me, no, at
Yeah.
asua at ust.edu.ph. I'd
Yun.
be more than happy to answer them.
Okay. Doc, thank you for joining us in this show. Mga ka-offbeat, if you like this episode with Doc Alex, feel free to follow us up in Facebook, Instagram, Spotify, and LinkedIn. Thank you, Doc. Maraming salamat po. Say
Thank you,
bye to
Lance.
our
Thank you,
audience.
Matt. No, it's really nice to have both of you, and I have a great time. Thank you for inviting me here.